Hi, everybody.
Hi, hello.
Hi.
Good morning, good afternoon, good
Morning.
evening, depending on where you are.
Hi to everybody. Hi, Carla.
We're gonna wait a couple more minutes for everybody to come in before we start, and we'll keep people muted just until we open up the meeting later. Just hold on another minute. Carrie, is there anybody else in the waiting room? No?
No, I'm sure people will. I'll just keep admitting them as they come
Okay,
in.
great. Okay, well then let's start. Okay, so welcome everybody. This is our second training. We did one last week. And I want to apologize from the very beginning for those of you who weren't able to come because we only had capacity for 100 people. We really had no idea that so many people would want to attend. And we learned very quickly that we needed to expand our Zoom platform, so we did. So now we can have 1,000 people. We're not going to have that many today, but we definitely are going to have more than 100. We already have 159. So thank you for your patience on that. And you can always watch the recorded version of the Not a Protocol training that we did last week. And I'm going to show you in a minute how you can access that if you have not seen it. I want to say just something for a minute about why we're doing this training. Our organization, Acupuncturists Without Borders in the United States, our mission is to bring Chinese medicine treatment for pain, stress, and trauma to communities that are affected by disaster, conflict, poverty, environmental devastation, and systemic trauma situations. So obviously this crisis in Ukraine is a huge one. It's an active war, which means, and this is really the first time we've worked in an active war situation. Often we will work after a big disaster like a huge hurricane or earthquake, but this situation is different. This is an active war, which means the conditions on the ground are changing all the time, and it means our work needs to be able to adapt to those changes. So the other thing that we are committed and dedicated to doing besides training, which is part of why you're here today, is to provide training for tools that you can use in the field or in refugee support situations or support of other people who experience trauma, is to help people set up projects in their own communities. And we're going to talk about that more later. Many people have written to us saying that they want to go to Poland in particular to help. And that is, we are incredibly grateful for the outpouring of generous offerings of service. It's also problematic right now to work in Poland, and I'll have Marek talk about that later. I see him on my screen because he's really our point person in Poland. But in a minute, I'm going to share with you some statistics that will show you how many refugees are in or coming to your countries now. In other words, there's a lot of work to do in the countries you're in. And so we're pivoting some of our attention to helping countrywide and community-wide organizing of projects. So we'll talk about that in a little bit after we receive our training from Dr. Richard and Dr. Songchuan Niemtzow. I want to first introduce the Executive Director of Acupuncturists Without Borders. He wasn't able to get into the training last week because he came in too late. No, he's never too late. Anyway, Nipin, I want you to introduce yourself and say a few words, and then we'll proceed. Go ahead.
Thank you, Carla. Thank you. And again, apologies on the initial training technical difficulties. So I decided to excuse myself to give another acupuncturist an opportunity to learn rather than occupy the space. But since we have expanded the platform today, I wanted to take the opportunity up top to just say hi. And again, as a reflect and resound what Carla said, we have been humbled. We have been really moved by the support and the kind of outpouring of concern and energy we have seen from the community. We are really hardened. And as Carla said, when we internally take the decision to engage this at this level with this crisis, an active crisis, we don't take it lightly. And we are bringing all our best to make sure that you all have the support. So that's one part. And I want to key in on one thing which Carla said about what is happening again in Poland or in other countries we will face, which is the challenges of working at the local level in when there is an active crisis. This is something I have faced in many countries. So even on your local level, when you're facing these challenges, I would ask you to not to be disheartened, to engage. It's especially challenging when people don't recognize the role of integrative medicine and traditional Chinese medicine in crisis situations. I have worked in crises where practitioners have difficulties accessing the big network of systems which come into play as well. But the main opening is, as Carla said, at the local level. We want to see not only hear from your challenges, we also want to see where you are making breakthroughs so that we can use that as an example to inspire others to give more space for practitioners to operate, especially in countries where there is high caseload of refugees. So please communicate. Communication is the other part. Whatever you're doing, let us know. You know the network of things available. You can reach to us. You have emails. We have the social media platforms. We want to, as we said, the main idea is to put front and center that we have a role in responding to crises, and we have tools and we have experience which we can bring to support the populations affected. And we do believe that the mental health support we provide is very, very critical and crucial and could have a life-changing impact. And that belief is what is driving us. And I believe that will drive you too, to make the best out of this training and start your projects and take this forward. I will stop there. Over to you, Carla. And I will, again, if there is anything you need to reach out, I'll put my contacts out there as well.
Thanks, Nipin. Yeah, I want to say that many of you have written to me specifically. Again, when we started this project, we had no idea how much outpouring of interest there would be. And so if I have not spoken to you directly yet or written back to you directly yet, please know that that will happen. I'm finally starting to catch up. The other thing I'm doing is, if you're writing me from a country where we already have organized leadership, I am forwarding your email to those people. And I want to actually recognize some of them right now. So, and again, we'll stay on after the training for anyone who wants to talk about organizing something in their own community or plugging in, connecting to the people who are already organizing in your country. So first, I just want to recognize Georgette. I know you're here, Georgette Young. Say hi. Oh, maybe she's not here. Anyway, I thought she was here. She's the head of the European TCM Association, and she's been instrumental. She's based in Athens. She's been instrumental in connecting a lot of us to you. Marek Thomas, Marek, can you wave? There he is. Wave again. He's our point person in Poland. And if Elżbieta Hayland is here, I don't know if she's here. She's also working in Poland. She works in Gdansk. She's organizing local practitioners there. I don't think Pedro Albuquerque is here. He is our point person in Portugal. We've had many people from Portugal write to us. It's been amazing. So I have been connecting you all to him if you are from Portugal. Susan Andrzejek, are you here? Susan is from Czech Republic, and she is organizing in Prague. Octavian Sabama and Christina Dinu Popa. Christina, I know you just came in, are in Romania. And actually, we've been doing direct services in Romania this past week. So I'm going to ask you, Christina, I know you just came in, to stay through the whole training so people can meet you at the end. And you can talk a little bit about what your plans are in Bucharest. Nancy Ellis, I know you're here. She's from UK. Tomorrow, we're going to have a Zoom meeting of people from UK. If you haven't heard from me yet and you're from UK, just make sure you put your information in the chat box so that I can send you a Zoom invitation for that meeting. And then finally, Marianne Ten Westenend. I know Marianne's here. There she's waving. She's one of our 2 team leaders in the Netherlands. And the Netherlands, I have to say, is awesome. They have been organizing for the last 2 weeks, and and so many practitioners from Netherlands have written to us. And we've been forwarding your information to Mariana, and she's been so good in contacting people very quickly. So if I'm forgetting any of you, please stay on at the end and we'll have more country-based conversations about what's happening. Just before I introduce our trainers today, I want to show you something that is, I think, helpful. So I'm going to share my screen. First of all, this is our website. This is where you can find information about the training links, the recordings of these trainings, if you have not been able to attend them. And we do regular weekly updates on the situation in Ukraine. This is my email address. So if you're interested in starting a project in your community or country, please write me here, okay? I have not been able, again, to respond to everybody who's written to me, but I'm going to try to finish that this weekend. And then I want to show you a little bit about why it's so important for us to focus on local organizing in your countries. Okay, in Ukraine right now, there are approximately 10 million people who are displaced. So 3.5 million of them are refugees who have left the country. The rest are displaced within Ukraine, okay? We are supporting Ukrainian doctors who do acupuncture inside Ukraine. We've been able to get some supplies to them as well as money. So we're doing that as one of the routes of our support. That's challenging, but we've managed to do it in several ways. So of the 3.5 million people who left Ukraine, I just wanted to give you an idea of these numbers, which have probably changed since I wrote this morning. And I put prior to the war for some of the countries, just so you could get an idea of like the ratio and relationship. Some countries in Europe have already got huge refugee populations from the last migrations from Africa and the Middle East, okay? So when I say prior to war, I'm really referring to that. In Poland, now over 2 million people, Romania, over 500,000, Hungary, Slovakia, and Moldova, in the 300,000s, Czech Republic, almost 300,000, Portugal is expecting up to 40,000. So again, all of you from Portugal who want to work, there's going to be a lot of opportunity for you to help people where you are. Denmark up to 20,000. Netherlands has 80,000 people from the last migration and is expecting at least 12,000 now. Sweden also a huge recipient of people from the last migration, and anywhere from like 40,000 to 200,000 expected from Ukrainian migration. These are expected cases where people apply for asylum, okay? France has 400,000 people now, expecting up to 26,000, or that has about 26,000 Ukrainians so far who've applied. Germany, almost 200,000, UK, 12,000, Israel, 11,000. And I put US there with a question mark because we don't know what's going to happen in this country. We have a lot of politics around immigration, which we're not going to talk about. So, but there will be some people who come, I know. So I just wanted to give you an idea of this because I think it's really important to know that you don't have to go to Poland to work and support refugees. There are plenty of people where you live and work who are going to need your help for a long time. And that's the other piece I want to say. Right now, it's very urgent. Again, we're in an active war situation, but this crisis is going to go on for months, if not years. And so your help at any stage of the recovery is going to be really, really important. So with that, I'm going to stop this share, and I'm going to introduce you to our speakers tonight. Again, this training is to help prepare you to work. And you will use it however you see fit in either teamwork or individual treatments, however you choose to use it, it's applicable. So I would like to introduce two speakers. Both of them have the last name of Niemtzow, and they do happen to be married. Dr. Richard Niemtzow is a medical doctor and acupuncturist in the United States, and he is the creator of battlefield acupuncture. Many of you probably have learned about this protocol, auricular protocol. Some of you know how to do it, and so we're really honored that he's sharing his life work with us today for this purpose, and are really appreciative of your willingness to share your knowledge, Dr. Niemtzow. And then after Dr. Richard Niemtzow speaks, Dr. Sangchuan Niemtzow will give us a presentation. She works with Dr. Niemtzow in private practice and has extensive experience in using scalp and body acupuncture for traumatic stress. We're going to have them do their presentation, and then we're going to have questions at the end, like we did last time. So if you have clinical questions that are not answered by the time they finish their training, please put them in the chat box, and Carrie, Carrie, who is our amazing tech human, among other things, is going to make sure that we cover the questions. And then after the questions are finished with our presenters, those of you who want to stay and talk with some of the heads of local efforts or countrywide efforts, please stay. So with that, I'm going to hand the baton over to our doctors to do their presentations. So you can share your screen with your presentation.
First, Sung and I are very honored to be here today. And we're speaking from a small town called Vienna, Virginia, about 30 minutes from downtown Washington, D.C. And as I mentioned, we are honored to be part of this effort to help the refugees during these very chaotic times. And I know the stress around the world is very significant. I had the opportunity to read a little few words from a colleague of mine, Dr. Stephen Greer, who wrote, "Never be discouraged by this transient time of chaos. Keep your sights fixed on that far horizon, knowing the far horizon is really not that far, for it is already here, folded within us." And I have read this several times, and I think all of us must look with optimism to the future, to the horizon. And as he said, it's probably already folded within us, ready to come out. I want to talk to you today about battlefield acupuncture, which is used for acute and chronic pain. And as you know, it is an ear technique. So what type of devices are used to stimulate the 5 points that make up the battlefield acupuncture in each ear. Semi-permanent needles, gold semi-permanent needles, work the best because they remain in the ear for several days and stimulate the points, allowing the patient to benefit from a reduction of their pain. Even magnets are useful. People like them because they are painless, and they also can be inserted on the acupuncture points that I will describe shortly. You can use press tacks. If you don't have any of the needles or stimulating devices that I mentioned, you can always use regular needles, keep the patient quiet for about 30 minutes and the needles intact, and then pull them out, and you will achieve a very significant pain reduction. As I stated in the slide, it's a 5-point methodology, and we like to get the patient up and walking in between each insertion. If a patient is not able to walk, give them a minute for the needles to do their thing. And in most cases, there's an 80% response. This is what the needles will look like in the ear. And I'm going to go over the needles, the locations.
Dr.
The
Niemtzow,
first-
Dr. Niemtzow, I'm sorry, your slides aren't on the screen yet. So let's make sure, there we go.
All right.
Great, thanks.
All right, thank you. I'm going to go over the points with you superficially and then in detail. The first point is the cingulate gyrus, which is located right at the bottom of the tragus. We're going to have more detailed slides, so you'll get an idea where to insert your needle. The next point is the thalamus. And you're probably saying, hey, the thalamus is inside the antitragus. We put it on the outside because it's easier for most people to stimulate that point. The third point is omega-2, which is on the helix of the ear, halfway down between the apex of the ear and where the ear attaches to the scalp. The next point is Shenmen. All of you are very familiar with this point, very good for relaxation. And the fifth point is point 0. And you can see I kind of like to bring it a little bit more posterior. You get a very good effect when it's placed in the area of the stomach and liver on the root of the helix. The battlefield acupuncture only requires, let me go back, only requires 2 exposed ears. So it's very, should I say, easy to administrate because you don't have to address the patient. So in an environment where people are sitting, you can effectively treat people without too much of a fuss. As you know, it's portable, it's easy, it's fast, effective, and safe. Contraindications would be, I would not treat a pregnant or a female that thinks she may be pregnant. I have, for cases where there's very intense back pain, and probably in the United States, we're so concerned over litigation that we always exclude pregnant females, but there are many people who treat pregnant females with battlefield acupuncture without any problem. I would not treat any undiagnosed pain. I think that's a very important factor. I would not treat anyone who has an aversion to needles or a history of vasovagal effects. If the ear has an infection, I would not treat that patient. And a relative contraindication are patients with bleeding disorders. There are some patients that have a fear of needles, and I probably, in this case, would use magnets because they're painless. As I've already mentioned, about 80% of your patients will respond. The pain relief generally lasts for several days, and that's whether it's acute or chronic pain. The more treatments you do, it appears the remission increases. So a patient may start off with remission of a few days, and as the patient returns and the needles are pulled out after about 3 days, and you do another treatment, the remission may even be longer. This is a good substitute. It's a quick pain relief and substitute for opioids. Some of the side effects that you may experience when you're needling a person, there may be some discomfort, there may be bleeding or bruising. A lot of patients experience euphoria. There can be lightheadedness. If there are keloids on the ear, I would avoid sticking a needle on the keloid. Very, very rare. I have never seen an infection. I have never broken a needle in over 22 years in doing the battlefield acupuncture, and it's extremely rare when a patient will faint or the symptoms will increase. Again, I bring to your attention, never treat any undiagnosed pain. For instance, the patient that's complaining of back pain could really be metastatic cancer. So you want to make sure what you're treating. Otherwise, you could end up doing a disservice for the patient. And you know that many refugees coming will have other problems that are producing pain. If you're using the semi-permanent needles, which we feel are the best way to employ the battlefield acupuncture, we'll show you a video how to insert and use the needle. I want to tell you, when you do use the needle and place it in the ear, it's not a squeeze. You do not squeeze the injector, you push the injector, and the needle will insert into the ear. There's either a 2 or a 3 finger technique. And again, I reiterate, push the injector into the ear and don't squeeze it. I've had people call me on the telephone saying, I've been squeezing the injector for an hour and the needle hasn't come out. So it's a push. Let me start with the first video. I will demonstrate a 2-finger and 3-finger insertion technique using the gold ASP needle. This is the 2-finger insertion technique. Notice the thumb and index finger on the injector. The injector is placed perpendicular to the surface, and in a gentle push, A click is felt and the needle is inserted. The 3-finger technique consists of the thumb, index finger, and the 3rd finger grasping the insertion device. The needle is placed perpendicular to the surface and inserted. I will demonstrate. Again, I show you pictures of how the needles should look on the ear. Again, this is the sequence, and you alternate ears. For instance, you have a patient sitting, and let's say they have back pain. You can start on any ear and insert a needle or a magnet or a press tack or whatever you have on the cingulate gyrus. It does not make any difference which ear that you start. So let's say that you started on the right ear. You have the patient, after you've inserted the needle, walk for about a minute. They get up and walk if they're able to ambulate, and that accelerates the process. You may have a patient who responds immediately to the first needle. That is, the pain completely disappears. If that happens, and it does frequently, you do not have to put in the rest of the needles. There is absolutely no advantage. But in the case where the pain does not decrease and you're aiming to get the pain between 0 and 1, you would go to the left ear, put a needle into the cingulate gyrus, have the patient walk. They come back, you get a pain score, and you keep going through the process. That is the thalamus, omega-2, Shenmen, and point 0. Most likely, even before you complete the 5 needles in each ear, the pain should be down to about 0 and 1. This occurs very, very rapidly, and the patient will be surprised, and so will you. I'm going to go over each point in detail, but I won't linger because you can replay the video over and over again, but it's very easy. The cingulate gyrus is located, let me go back, on the tragus. There's cartilage, and immediately under the cartilage where there's skin, that's where the needle goes. And as I mentioned, if you don't have these types of needles, whatever you're using to stimulate the ear will be placed in the same location. So you have the tragus of the ear. You then go immediately into normal skin, which is at the bottom of the tragus. The next slide, here's a picture of a patient with a gold ASP needle, semi-permanent needle in the cingulate gyrus. And you're needling a zone. The battlefield acupuncture is very forgiving. So even if you think, well, gosh, I didn't get it exactly, the tolerance of the battlefield acupuncture is such that there is a zone where you need to get the needle in. So if the needle goes over here or goes over here, or even over in this direction, you're still going to experience a benefit for the patient. The next point will be the thalamus. And I know immediately you're saying, well, the thalamus is in turn of the antitragus. Put it on the outside. It's just much easier because what happens when people are placing a needle, they end up putting it on top of the antitragus, or they don't even get it exactly where it should go on the inside of the antitragus, and the pain attenuation is less. So to avoid that problem, place it on the outside of the antitragus. You'll notice that the antitragus, there's a hump, and then all you do is place the needle halfway down the antitragus. You take a good look of the antitragus, you see the top, and you go right down so that you're in the middle. Very easy to insert. The next point will be omega-2. And if you look at omega-2, here's the apex of the ear, and you slide down the helix and go halfway down. The helix is like a slide where you slide down halfway, and you're between the apex and where the ear attaches to the scalp. Let me give you another picture. This is a good picture of omega-2. Here is the apex of the ear. This is where the ear attaches to the scalp, and the needle goes right in the middle. Shenmen, I know there are various versions of where to place Shenmen. In the triangular fossa area of the ear, I go in the posterior aspect. Some people call it the apex of the triangle. I just put it where the needle is shown, and it works fine. And as I mentioned in the beginning, it offers a kind of tranquilizing anti-anxiety effect for the patient. Here's another good picture of Shenmen, the spirit gate. The last point is point 0 that all of you know. You're probably familiar in placing point 0 a little bit higher up on the helix. I bring it back, as I mentioned, posteriorly. It seems to give you a better effect. So I've covered all the points of the ear that I think most of you are familiar with. And I have a video that I will show you with the placement of the needles. I do want to mention, when you're placing any device in the ear, you want to take precautions. And I use alcohol to cleanse each ear, and you only have to do it once. So let me play the video for you. Affect the ear with an alcoholic swab. I will demonstrate using a gold ASP needle the 5 points of the battlefield acupuncture technique. The first point will be the cingulate gyrus. The second point will be the thalamus. The third point will be omega-2. The fourth point will be Shenmen. The fifth point will be point 0. All right, let me go past that. Just remember, when you're doing the battlefield acupuncture protocol, select your patient appropriately. In our country, we have to get a consent from the patient. Clean your hands, clean the ear, place the needle with the patient sitting. After each insertion, walk the patient. Remember your goal, you're going to get the pain down between 0 and 1. 1 is good. 0, of course, is even better. That should be your aim with the battlefield acupuncture. All right. And remember, you're alternating each ear as you place the needle in your quest to get the patient pain-free. When do you stop? You stop if the patient asks you to stop. Obviously, if the pain is reduced down to 0 or the patient feels very comfortable, you would end up stopping. If the patient experiences any lightheadedness, I would stop. I probably would pull the needle that causes that. It's very rare, but it can happen. Again, a vasovagal reaction indeed is very, very rare. I would have the patient relax for the day. I would make sure that the patient pulls the needles out after 3 days. If they have a container, I would place the needles in the container and not just simply throw the exposed needles in the trash basket. I would have the patient look for any irritation, inflammation, and infection. And of course, if they begin to see a reddening of the ear, I would tell the patient to pull the needles out. I'm sure afterward there will be an opportunity for you to ask questions. This is a very simple technique, and literally thousands of people, not only in the United States, but internationally, are using this technique to reduce acute and chronic pain. So I'll stop at this point.
Thanks, Dr. Niemtzow. I just want to remind people to put your questions in the chat box. And if English is not your, if it's difficult to write in English, then save your questions for after Dr. Song Chuan Niemtzow does her presentation. So I just wanted to make one comment about your presentation, Dr. Niemtzow. And maybe this is something you can talk about in the question section, which is the relationship between pain and trauma, why it's helpful to reduce pain when you're working with trauma. And I can guarantee you that many of the refugees that you're going to see have a lot of pain issues. So knowing how to treat pain quickly is going to help reduce the trauma effect as well as address their pain. And the second thing is, at the end of this, we'll talk a little bit about how you can get ASP needles in Europe, okay? So with that, I'm gonna give the attention to Dr. Song Chuan Niemtzow for her presentation. Thank you.
I'm gonna try. I can't because it's for this screen.
Okay.
All right.
Okay, good evening, everybody. My name is Songxuan Zhou Niemtzow, and I'm a practice acupuncture in the United States. So, beginning, thank you so much for your willingness to help the refugees during this the most difficult time. I would like to introduce my stress rapid acupuncture protocol to you. So this stress rapid acupuncture protocol is a component of my PTSD clinical trial. So the stress protocol, I think will be benefit to your patients because it will reduce anxiety, depression, insomnia, nightmares, stress, and it also will relax the patients immediately. Next
I
slide.
can move it.
So the needles that are used on cell number 3, actually G-type needles. So the gauge have a gauge of 0.20 millimeter and the length of 30 millimeter. And I always use guide tool. So to start, but if you have any other, whatever the needles you have available, that should work very well for you too. So to start the protocol, I need a Heart 7 and a PC6 bilateral. In this slide, you are able to see, and I think you all are familiar with the PC6 and the Heart 7. Next, I go to the forehead, and I need a Spirit 1 and a Spirit 2, but the Spirit 2 bilaterally. So the Spirit 1 is a 1 cool above from EX2, okay? And the Spirit 2 is a 1 cool above from the gallbladder 40, as you see in the picture. So Spirit 1 and the Spirit 2 bilaterally, these 3 points can form look like a upside down triangle, okay? And next, I'm going to go to the, I'm going to needle the governor vessel 24. So as you see in the slide, and I think you all know the location of the governor 24, governor vessel 24. Next. And then afterward, I end the blend 3 and the blend 4. Blend 3 and the blend 4, both points are bilaterally. So the picture, the points look like in the slides. So governor vessel 24, blend 3, blend 4, they are on the same level, above 0.5 coulomb, above the hairline. The next 2 points, I'm gonna end on governor vessel 23 and the governor vessel 22. They are on the middle line of the hand. So governor vessel 24, governor vessel 23, and the governor vessel 22. They are on the middle line of the hand. So on the points look like here in the slides. So horizontally here, same level, like a 5 points, and the middle line over the hand is 3 points. So look like upside down capital T, if you wanted to look to remember that way. Then and to the I'm going to the further posterior, top of the hand. So first point on the top of the hand, you needle GV20, governor vessel 20, okay? And then around the GV20, there are 4 points, EX1 posterior, EX1 anterior, and EX1 right, EX1 left. So EX1 is just 1 cool from the GV20, and the 4 points same distance from anterior, posterior, left, right. So like it form a circle around the GV20. Afterward, the next point, and also the last point is a shaman. So I end the shaman on the both ears. So you can use the needle, semi-permanent ASP needles. But if you don't have ASP needles, you can use Sarah needles, whatever available, whatever type of needle you have that works well. If you don't have any needles, you can also use the seeds to place the point of this shaman. So this is a part of my PTSD clinical trial, but it works very well, and they easy to learn, and the patients do not need to take clothes off. They don't need to take shoes off. You just let the patients sit, and then you place needles on them, and you will you will be surprised with the immediate results. Most patients just tell me after I finish needles, they feel really calm. So this is very simple to learn and easy to administer to your patients. Any questions?
So let's, thank you so much. Wow, thank you so much. I know that some people wrote questions into the chat box. So Carrie, I'm gonna let you read them out, but I have a question. Dr. Song, can you repeat the location for Spirit 1 and Spirit 2?
Yeah, Spirit 1, keep breathing.
Sure.
Wait, let me find
Let me
the,
get the,
I see the slides over there. No,
what's it? Are you able to see?
not over there.
No, we need to have you share it again.
All right, hang on. Okay, let me get the share button. Just a moment. Here
I'll
we
ask
go.
you another question in the meantime, Dr. Song.
Yes.
How long do you like to keep the needles in for this protocol?
So the needle, you can put it like 30 minutes, for 30 minutes enough.
Okay.
Are you able to see it?
Yes. You just have to go back.
All right, it's a little tricky on this.
That's okay. And maybe keep it up there because there might be some other point locations that people want to
Yes.
hear again. Okay, great. Thank you.
Okay. So this is the Spirit 1 and the Spirit 2. Spirit 2 is bilateral.
Mhm.
These
Spirit
3
two.
points is really good on anxiety patients to calm them down immediately. Okay, so Spirit 1, this is the point EX2, in Chinese called Yin Tang. Yes, so you go 1 ku above the exact go above, directly go above 1 ku above from EX2, okay? And then Spirit 1, this is a G gallbladder 14, in Chinese called Yang Bai. So go directly above 1 ku, above, go gallbladder 14. And then you put the needles just downwards. The needle, the direction of the needle after you go through the skin, go downward. Okay. So 3 points, easy to remember. If you cannot remember, you just remember like a upside down triangle.
Okay.
But these 3 points are very good for anxiety patients because I think refugees, what they are going through right now, very anxious.
Yes. And last question from me. Do you use these 3 spirit points plus all the other points on the scalp together?
Yes, yes. So you put it when people up, when patients sit down, you put the 2 points, heart 7 and PC6 on the wrist, and then you go on the forehead, 3 points, spirit 1, spirit 2 bilateral, and then you go to the scalp points. And the final point is put on the ear, shaman. And you keep them 30 minutes and pull needles out after 30 minutes. And some patients, after you put the needle, after you just finish the needles, they immediately tell you they feel calmer and less anxious.
Do you do this? Do you feel that it's important for people to be lying down for this protocol, or can you do it with them sitting?
Both ways, you can let them lay down, but I think sit down is good because many patients are easy to sit down and they just they don't want to take clothes or shoes.
Right. Right. Okay. Thank you so much. Carrie, do you want to go over some other questions that came in the chat box?
Yeah, sure. Well, the first one was from Nikos and wanting to know if we'll cover the needles, and I think the battlefield acupuncture needles, and I think Carla, you're going to discuss that at some point. Okay.
Yeah, at the end.
Okay, Virginia asks, and this is for Richard, I notice you used your left hand to insert the needles and right hand to hold the ear. Are you left-handed, or do you use the alternate? Do you alternate inserting the hand based on which ear you're inserting into?
All right. And for me, I can insert the needles either the left hand or the right hand because I've done so many. When you're doing omega-2, all right, that's a little bit different. So if you're doing omega-2, you want to hold the ear with your left hand between the thumb and index finger and put the needle in with the right hand. You know, I can describe it in words, but probably, as you know, the battlefield acupuncture is best learned in a workshop. So doing it this way, you know, if you haven't done this before, get a friend or someone that's not a patient, and you can practice doing it. You don't necessarily have to needle someone, but you can kind of work your hands to get the feel as to how you're going to do it.
Okay. And then let's see, Melanie asks, can ear seeds be used in battlefield acupuncture instead of needles?
And what, I didn't hear.
Ear seeds?
Yes, they're probably not as effective, but people have used them.
Okay, let's see. For a battlefield acupuncture again, how often do you repeat the treatment?
You know, every patient has their own relapse rate. So maybe you could say rule of thumb twice a week.
Okay.
Some patients, you'll find this interesting. I've had patients where I've said, Let me know when the pain comes back. Here's my number. Give me a call. And I've had patients call me after 1 year saying, do you remember me? You told me to call me when the pain returns. It's been a year and the pain just returned. So we have a whole bunch of patients who fit in that category. Contrarily, we have patients that maybe after a couple of hours, unfortunately, the pain returns.
Okay, and on that note, Katerina wants to know what types of pain you can treat with battlefield acupuncture.
Any acute and chronic pain, the whole spectrum of pain, back pain, leg pain, ankle pain, headaches, you name it.
Okay. And this is, I think this is for the scalp acupuncture. How long do you leave the needles in?
30 minutes. Half
15
hour.
minutes?
Half hour.
Okay. Let's see. And I'm skipping over some of these questions that other people seem to have answered in the chat. So if they're not answered at the end, just put them in again and we'll try to cover them. Nikos asks, what is the angle of insertion of EX1?
The angle, you can put it downward like a 25 degree downward to the face.
Okay. And what was the needle length that you used again?
The needle length, if you have a guide tube, you just tap in, okay?
The length, how long?
The length.
How long?
30 millimeter, the length of the needle I use.
Okay. And I think you answered the question. Tiago's asked, do we need all these points? It seems for some more frail patients, they might be too weak to have so many needles. So could you use PC6, Heart 7, and do 24? Would that be enough?
That if some patients they really feel needles, you can use the top 5 needles and the shaman. That's also help for the depression or anxiety or stress, especially 5 points on the top is very good for insomnia and nightmares.
Okay. And do you have experience with this protocol in people with long-term PTSD or CPTSD?
Yes, because right now I'm treating many PTSD patients, and right now we are doing PTSD clinical trial. So I see the patients that really benefit from this protocol.
Okay. This is for Richard. I can imagine that a lot of refugees have pain but are not properly diagnosed yet. Can you still use battlefield acupuncture?
Yes, I would make them comfortable.
Okay. Hold on, just a lot of questions coming in here. Caroline says, so battlefield acupuncture is for physical pain and scalp acupuncture is for emotional distress?
Yeah, emotional and mentally.
Okay. Let's see, are the bilateral needles right on GB14 or just above?
Above GB14, 1 cool.
Okay. Jenny says, I wonder about Buddha's triangle, lung 7, heart 7, or sorry, lung 9, heart 7, pericardium 6, and where this might fit into the anxiety protocol. She says, this is my go-to for anxious patients. So basically the addition of lung 9.
Can you repeat again the question?
Yeah, they're wondering about Buddha's triangle, lung 9, heart 7, pericardium 6. And where,
Pericard 6
and lung 9.
and lung 9.
No, I don't use a line 9, just use a heart 7 because a better result from my experience.
Okay. Can both of these treatments be delivered at the same time?
Yes. If they have a physical pain, you put the BFA first, and then after you put the BFA, you put the stress protocol, and they're good.
Okay. And okay, so it was 30 minutes for the scalp acupuncture, and then for the battlefield, how long? Let's see, the needles stay in for 3 days. Was that what you
Correct.
said? Or?
3 to
Three
5 days.
3 to 5 days.
And those are the special ASP needles, which Carla will go over in a little bit,
Yes.
as I understand. Okay, I think I've hit the end of it. I'm just gonna, we can continue on, and if I didn't answer, or if I didn't address any questions and you still have them at the end, please type them in and we'll try to get to them.
I want to just say one thing about the fact that we presented the NADA protocol last week, and now battlefield acupuncture and Dr. Song's rapid acupuncture protocol. The use of all of these, and there are other protocols that people use for pain and traumatic stress. These are the ones that we have the most experience with. And I think that it's important to think about context, okay? If you're seeing 500 people, 300 people in an afternoon in 4 hours, you may choose to do something very simple like NADA, okay? Because everybody would get the same treatment. If you're in a smaller kind of situation where you have, say, 30 refugees, I'm going to give an example, in a clinic that are coming in over a period of time, then you can work more individually and in a more focused way with both pain and traumatic stress. So I could see these, I can see, for example, if somebody has a lot of pain and you're in a big treatment situation, using ear seeds, okay, on the battlefield acupuncture points for somebody who you will never see again might be a useful decision, okay? Because you don't know where that person's going. You can't follow up if there's any irritation or inflammation. You can use the protocol, just use a different tool to stimulate the ear. Whereas if you have more ability to follow up with the patient, then using the ASP needles is a great, is a great choice. And if people can stay long enough to have a longer treatment, they can have Dr. Song's protocol as well. So it's important to think about the venue, how many people there are, how much time you have to treat people, and you can apply these different protocols depending on the situation. And I don't know if you want to comment on that, Richard or Song, but I feel in our work, for example, if we have to do a lot of treatments in a short amount of time, we rely on usually NADA or one ear protocol. Whereas if we have more time and more follow-up opportunity, we can do more protocols. So I don't know if you want to comment on that.
Yeah, with the battlefield acupuncture, I mentioned you kind of walk the patient in between insertions.
Right.
If you don't have the time or the space, you can put 5 needles in each ear and be done with the protocol. And the pain will go away. You can maybe wait 30 seconds and say to the patient, how is your pain? And keep progressing to complete 5 needles in each ear. As I mentioned, we have many patients that will respond after 3 needles and you're finished. So it depends on the patient, the pain, and acute or chronic pain.
Right. And Dr. Song, do you have any comment on, because oftentimes in the refugee treatment situation where it's very chaotic maybe, and many people in a shelter, like, do you, and we don't know the physical condition of people. So sometimes people haven't had food or water for a period of time. Do you have any recommendations on safety for using your protocol? Do you want to make sure people have had something to eat or drink, especially if they're sitting down, so that you can avoid fainting? Is there anything like that that you would want us to know?
Before acupuncture, doesn't matter what type of acupuncture or protocol you use. Before you start to treat patients with acupuncture, if they always eat something or not, at least not hungry, is always safe. Otherwise, some patients may faint.
Okay. And do you have any adaptation of your protocol for children that we should know for treating children?
Sure. With the battlefield acupuncture, I would not use ASP needles.
Right.
I would do electric stimulation or even a laser stimulation or magnets. I would not use needles.
Right.
Same thing for the stress for the kids. Just simply use the magnet seeds, put the shaman, and other even use other points for kids.
Okay. Any other, oh, there's a few more. I can see a few more questions, Carrie. Like Shonishin.
Yeah, well, someone first asked if you can use magnets for battlefield acupuncture and how long you can leave them in place.
You can use magnets anywhere from 600 to 12,000 Gauss, and you can leave them in, when the pain stops, you kind of have to use some common sense with the patient. You can say to them, rule of thumb, remove them after 3 days. But if they keep them in longer, especially the magnets, nothing bad's going to happen.
Okay, and then could Shawnee Shen work for children?
I didn't get the last.
Shonishin.
Am I saying that right? Yeah.
Yeah. Shonishin, I don't mind answering that question if you don't want to, unless you want to.
Sure, go ahead.
I think that, many of you have probably learned techniques that work for children that are topical stimulation of the points. This is all good. My experience in working with kids in this situation is I use ear seeds on the points, okay? And put them on the points like Heart 7, PC6, Shen Men. The kids like them. They want to press on them. They're really compliant. They're really good. They may color them so they become red or purple or blue. You can be really creative with children. The other thing I like to use is a soft toothbrush, okay? Soft toothbrush. Stimulate the points with a soft toothbrush. So for example, if you put needles in the mother or the father while they're resting, you can treat the children. Take a soft toothbrush and stimulate the points. It's like 30 seconds each, okay? This is a really effective way to work with children that they like, okay? You have to press hard enough so it doesn't tickle them, okay? But they like it, and this is one of the things that you take with you in field work. You take clean, soft toothbrushes to work with children. And those are often well donated by companies that give you, or you go in the airplane and they give you, special toothbrushes in your packet on the airplane. Keep them, use them. So topical stimulation is like the best often with kids, and you can do it while the parents are getting their treatment. It's a good way of using time. If you really want to learn about that, you go into acupuncture or Japanese acupuncture treatment for pediatric patients, you can learn a lot and use it really well in the field. The other thing that we have not talked about, which I'd like to talk about, not today, but I want to actually offer a training on it, is how to use essential oils or aromatherapy for trauma, stress, and pain treatment in the field. It's a very effective way to work with herbs where you do not have to eat them. You smell them or you put them on the skin, and they are really helpful with acupuncture. So that will be another training for those of you who are interested. So that was my answer for the Shoni Shin. Sorry about that. Took a long time, but I know from working with lots of kids, the thing with working with refugees is half of the people you treat are children. And especially in this crisis, because almost everybody coming out of Ukraine is either biologically female or identified female or child. Okay, other questions?
I think that kind of that might have addressed Virginia's question about using the scalp points on kids. Is that would you use the toothbrush for that?
You can
as
you
well.
can.
Yeah. Okay. My mouse just stopped working, so I'm having a hard time scrolling.
It's possible. I see this. It's possible we may not see the patients again. Would you still leave ear needles in? Or is it okay to retain the needles for 30 minutes and remove them for pain relief? Okay, I don't quite know the question. Are we talking about DAF needles, Jill? Jill Brown is the person who wrote the question. Okay, yes. Okay.
If that is for battlefield acupuncture and you're using the semi-permanent needles, I would not pull them out after 30 minutes. It will be very painful. If you're using regular needles, of course, you would pull them out. You don't want them walking around with regular acupuncture needles in the ear. That's why magnets are very useful, because there is no risk of infection. And with the magnets, there is not a risk of, should I say, overdose.
Okay, is your mouth still not working, Carrie? I can go through.
No, I am just using the touchpad, but it looks like we've reached the end of the questions for now.
Yeah, it's just on the head, on the toothbrush. It's the brush part, not the handle part.
Yeah. Oh, and how do you differentiate the use of seeds versus magnets?
It depends on what you have available. I would prefer magnets before seeds.
Okay.
I also have to tell you, I had a colleague that was a trauma surgeon, and you all remember the earthquake in Haiti many, many years ago. They told me that they had very little of any supplies during the beginning, right after the earthquake. So they were using their fingernail on the battlefield acupuncture points on patients. They were pressing their fingernail with their own hand on the patient's ear, and told me they were getting very rapid pain relief.
Yeah, on that note, this happened to us after the big earthquake in Nepal in 2016, I think it was. We were treating a lot of people, and eventually the Nepali acupuncturists ran out of ear seeds. So they took quinoa seeds or any kind of small seed and and they made their own seeds, and they just attached Band-Aid material, adhesive to the seeds, and they made their own. So like you can use in these situations. I mean, we're dealing right now with a refugee crisis where you're going to have some access to the supplies you need. But if you're in a place where you run out or there's no supplies, you can usually always figure out a way to wing it, as we say in English, where you use something else. You use Coke bottles with lids for sharps containers in Haiti. That's what people used. They didn't have any. So creativity is very useful in this situation. If there aren't any more questions for the doctors Niemtzow, I'm going to release them from our training unless they want to stay, because I want to talk a little bit more now about organizing that's happening in Europe. So last chance for questions from Song or Richard.
Can you also use it for pain that is experienced once in a while, but not during the session?
In that case, for battlefield acupuncture, you'd put the 5 needles in each ear. If they come in and have no pain.
Okay.
I want to also, again, I'm sorry, go ahead.
Are there images online summarizing the battlefield acupuncture points?
I'm sorry, is there?
Is there an image online somewhere summarizing the battlefield acupuncture points?
I know that if you go searching for it, that there are YouTubes made by different people.
Mhm.
Okay.
Yeah. Just type in battlefield acupuncture on YouTube. You'll find a lot.
Yeah.
Mhm.
And you'll find some good demonstration videos too about how to insert the ASP needles. And remember, this training is being recorded, so you can always go back to this section where Dr. Niemtzow has presented his slides.
I think that I missed one question about what the gauge of magnets that you should use.
Yeah, I mean, usually the magnets come in Gauss, which is the strength of the magnetic field. I would not go below 600 Gauss.
Okay.
And if you go up to 12,000, they're a little bit bulky, okay? A lot of people feel comfortable with 800 Gauss, and they have adhesive tape. They are painless for the patient.
Also, there's a question here that's important, Carrie. Whether you put adhesive or plaster over the battlefield acupuncture needles.
Yeah, I can answer that. You have to be careful with women with long hair, because if you put the tape on the battlefield acupuncture needle and the patient's hair is wet touching the tape, you have a perfect environment for a bacterial infection, because the adhesive becomes moist and bacteria likes to grow in that environment. The ear is warm and wet, so be very careful in the use of tape with patients who have long hair that covers the ear.
So are you saying that you prefer that people put tape over the ASP needles?
No,
Okay.
I do not, yes.
Okay. I also just want to reiterate the whole interdynamic relationship between pain and trauma. If you work on pain and reduction of pain, and this is science, this is not just an idea. If you work on pain and somebody is in a traumatic pattern, the trauma pattern reduces, and vice versa. Okay, you work on trauma and usually chronic pain will reduce. So no matter what protocol you choose, you're going to, it's a comprehensive approach. Okay. So, and the other thing I'm just going to say on a very practical level with pain in these situations, think about it. People have been carrying their children They've been carrying their suitcases. They've been carrying their animals. They've been outside cold. They've been standing forever. So pain, immediate pain, and then chronic pain that's exacerbated by the physical experience of fleeing, and then getting to a place where they may not be able to lie down for a long time or take a shower. They're cold. This is what you're going to see a lot of. The pain is a very big part of the picture for the refugee community, especially older people and people who have to carry their children and literally, I mean, think about what it's like when you have to go to the airport and carry, your suitcase and a kid. Well, this is like many times that. So that's part of what you're seeing in refugee communities in situations like this. So anything else, Carrie?
Krista just asked a question about nada, but I'm not, we went over nada last week, but says, did I understand that it should be in the left ear?
Okay, I don't.
Right for right people and left. I'm sorry, what?
Is this for nada?
Yeah, I'm not sure, Krista, is this for nada or for battlefield acupuncture? She's wondering if it should be on the left ear or the dominant side, right for right. I'm kind of confused.
No, nada can be done in 2 ears or 1. It does not matter which.
Okay.
Because remember from last week's training, the vagus nerve, which comes from the brain that affects all of the organs, has a branch into both ears. So you're stimulating the vagus nerve and regulating it when you put the needles in, and you can use either ear. It doesn't matter.
On the battlefield acupuncture, there is a dominant ear.
Okay. So can you just say that for a minute? Say that again, like how you would choose that?
That's why with the basic battlefield acupuncture, the needles go bilaterally because it's a little time consuming for somebody, and especially in a refugee environment, to figure out which ear is dominant for the BFA. So that's why the 5 needles going in each ear, you solve the problem.
Okay.
Okay. I think that answered the last question in there about both ears or 1 ear. So I think that's it.
Great. Carrie, would you do me a favor and put the link to the aromatherapy training in the chat box?
Sure.
Okay, and I'll address that in just a second. So again, Richard and Song, thank you, like from the bottom of our hearts, for your generous offering and training today. I can't tell you how grateful we are, and again, what your work will mean for us to use in assisting a lot of human beings. So thank you. And you're welcome to stay, but now we're going to talk about organizing and a few other logistics. Like I'm going to tell people where they can get ASP needles in Europe is what I'm going to talk about.
All right.
Okay.
It was an honor and pleasure to teach everybody, and God bless you for all the good work that you're doing. Bye-bye.
Thank you.
Thank you. Okay, got to tear up there. Tear up. Whew. Okay, so I want to say that we have a course on aromatherapy. It's a 2-hour course. Carrie is putting it on the web, on the chat box, where you can look at it on our website. And if you really want to learn aromatherapy, you should take it, because it's not just which oils you use when, it's why and what the science is behind it, and safety issues, because there are safety issues involved with aromatherapy, just like herbs. So I really encourage you to take it. I actually taught it. I don't teach all the courses at AWB. This one I taught because I am so in love with essential oils and aromatherapy for trauma treatment. And so, and I like plants. So I encourage you to, we'll probably do something like this, more informal in the next month. But if you really want to learn aromatherapy for trauma, please take the course. And it's not very expensive, but it is one of the ways that we receive income for our work to support this work. So I encourage you to take it. And I think it's pretty interesting. It goes, I think we use, it's like 20 different essential oils that we cover. And I'm going to give a shout out to Greece here. My favorite sourcing for essential oils is Greece, where we work with refugees. So it's my favorite spot, and you probably will have more access to some of those essential oils in Europe than I do here. I have to actually go to Greece and get them. Anyway, that's that. I want to talk about ASP needles, the needles that are used for battlefield acupuncture. So some of you may know, can people raise their hand if they know they have access to these needles? I can't really see everybody, but okay, I can see Marianne has them. Okay, let's see. Carolyn, okay, there's some people that have access. Okay. I don't know, all of you get your equipment, your acupuncture needles from different companies. So it's something to ask your company if they have ASP needles, okay? Meanwhile, so that you can get them quickly. Meanwhile, our supplier in the United States, Laza OMS, who is an amazing, generous sponsor of our work around the world, an amazing company that has worked with us for years. They have a supply of ASP needles that have been donated. So they're working with their sister, brother, collegial company in France to get the ASP needles there so that we can then distribute them to different groups in European countries who are going to be using them with their refugee communities. So I just want to tell you that that's happening. It's not accomplished yet, but we're working on that right now. So if you think you're going to want to use ASP needles regularly in whatever kind of refugee support work you do, it would be good if you actually wrote me an email so I can start that process of getting supplies to you from France. Okay. And if you have questions about that, put them in the chat box. He likes to use gold. There's two kinds you can use, gold and stainless steel. And I've asked him his preference and he says gold. And there will be gold. I mean, we'll have those available. So I just want you to know that those supplies are going to be among the things that we can make available to you because they're not as common necessarily as other types of supplies that you get regularly from the companies that you order from. The other thing I want to tell you is that we are in the process of translating almost all of our documents to Ukrainian and other languages. So for example, if you're going to work in your community with refugees, we will have a flyer that you can give to your patient in their language so that they understand the treatment. And so this is something that we're working on now, but I want you to know that you'll have those kinds of resources available from us. What you have to use in your own countries for informed consent, etc., are specific to your country, but we have some incredible Ukrainian-speaking acupuncturists here in the United States, and one of the things they're doing right now is translating everything we ask them to translate. So depending on what you need for your country, we can get it translated pretty quick, usually within 48 hours. Okay, so now what I'd like to do is introduce some of the people that I talked about before and see if any of them are still here, so that they can give you a little update on what's happening in their country. And then at the end, For those of you who are coming from places that I haven't mentioned in terms of receiving refugees, I really did not mean to exclude anyone. I know there are people here from Ireland and Scotland and other Italy, places where refugees are coming. It's just that we haven't made connections yet with people in the country who want to organize projects, okay? So I want to introduce, so please stay on. If you want to do work in your own country, please stay on now, because part of what you're going to see is what's happening in each place and what has to happen in order for a project to be created. This is actually the hardest part of this work. The clinical part is the easiest. You're all trained acupuncturists. You know what to do. It's organizing people to deliver the services, to deliver the treatments in a way that works in the community that is the more difficult part, and it takes the longest. So I want to go back to my notes here. And Marek, do you want to, are you still here, Marek? Is he still here? He may not be. Marek from Poland.
Yes, I'm here.
Oh, good. Take the stage. Tell us what's happening in Poland.
Well, generally nothing new. About 2 million refugee. Today was 2,175,000 up to 8 o'clock morning. And from that number, 285,000, they moved to other countries. So anyway, we have about 2 million. It's different in different cities. In Krakow, we are still working with offices. So we can't work doing NADA protocol and battlefield acupuncture and so on, because we are waiting for approval that we can go to some places. I sent emails. Kasia, our coordinator, is also trying to do some other things, but till now we are stuck since some days, since end of last week. And we are waiting if the community officers agree that we can go and work. So bureaucracy is more important than real treatment and help. Pity.
Have you had any contact with UNHCR, Marek?
With whom?
With the United Nations Human, the refugee organization, UNHCR? No. They, because it's refugee issues, I feel, again, my experience, even working in Bangladesh with Rohingya refugees, when it's a fully refugee situation, because they don't work inside Ukraine, they only cater to take care of the population outside. I think they usually, because of the concern around safety of children and women in this crisis, because there's a lot of actors who come into play, they really pull it tight with the government. And we need to really break into some of the contacts there who are especially working on the health side, who could be helpful. I can look up some contacts and I will pass it over through Carla, maybe some contacts. I was on a phone call today where within Ukraine, all the agencies, including Ministry of Health, was talking about health situation in Ukraine and movement of supplies and things like that, which is very dominated by the WHO, the World Health Organization. But outside country situation, it will be UNHCR. This is all confusing, but these are the kind of things which we can deal with at a country per country level, as we have team members to assist you with some information, contacts whom you could contact to establish. But it is, as Marek was saying, it is important that that legwork needs to be done by people on the ground in country.
Yeah.
Thanks. Yeah, thank you. We can try to do, but now I see the situation that the bureaucracy, it is on every level, it is overwhelming everything. And before it was totally volunteer. And there was many centers which were working completely independent. And now all of them, they are taken over by community, and they have own branches. And, you know, even I sent letter and it was approved with approval. And we are in the list of accepted, not accepted, it's not wrong, it's the wrong word. Recognized organization which offered help. So it's some like the bank of that organizations. So this is one list. But then, you know, the centers are under cover of another branch of another institution from the community. So again, you know, I sent another, I was calling to the secretary of the director, and she told, okay, send us mail again, you know, not again, you know, to them. I thought, but that letter was already sent to the president of Krakow, vice president, and so on. No, we have to have blah, 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 blah. So, you know, every level again and again, and now we are waiting for approval of that institution, which is really taking you know, they are responsible for the refugee centers and so on. And we have been very delicate and skillful because they signed contract with some medical company, which is giving medical help for refugee, and knowing very well situation in Poland between Western doctors and Chinese medicine. So 95% of Western doctors are against Chinese medicine, not that they have real arguments, but because of that they are against. Stop. No discussion, there is opinion without any real arguments and so on. They don't like to cooperate and so on. So we are showing that we are not against, we like to help them, support them, but we will see who is more influential in that community office.
This is part of the challenge in a place like Poland, where unfortunately it's a bad situation because you have that acupuncture and Chinese medicine is not yet a part of the system in the same way that it is in some of the other European countries. And yet you have the most refugees coming. So this is why I say that the treatment part is the easiest. The hardest part is usually getting access and approval or being allowed to actually offer the medicine that we have to offer. So I'm just going to give Marek like 1,000 gold stars for everything he's doing, because I talk to him regularly, and he's in a, you know, the Chinese medicine community in Poland is amazingly generous and ready, but it's fighting it's fighting upstream in many ways. Is Elzbieta here from Gdansk? I don't know if she is. Okay, I don't think she is. She's working in a smaller city in Poland, and she's having some success because it's smaller, it's more local, and she's setting up with a team there. So I think that's the other thing, you know, the kind of more local you can be, sometimes that's the more successful approach. So thank you, Marek, you know, thank you. And we're gonna just all keep working on it. I wanted to see if Pedro's here, Pedro Albuquerque from Portugal. I know he came in before, but he may have gone away. Okay, I think he went away. Again, for those of you from Portugal.
Say 2 words from Warsaw, because
Oh,
Warsaw.
do you want to talk about Warsaw, Magdalena?
Yes,
ahead.
I just want to say that similar situation as Marek described, but it looks a little bit promising. I can see some sunbeams. So yeah, it is indeed important to reach the right people. I mean, to have this luck, because it's not really the strategy. You just have to be lucky. So probably within several days we will be allowed to work in Torvar in the large sports hall where people go every 2-3 days. I mean, new people arrive there, but apart from that, I decided to go to the station, to the central station, and just go there and just without permission, without asking, just offering, just talking to people. I'm also a teacher, and I have some Ukrainian students, so I will have students with me to translate, and I'll be just going there. So apart from having the regulations, meeting all the requirements, and having the agreements, I just think that it might also work. And just I also talked to the medical coordinator, the medical doctor from the sports hall, and the outcome of our conversation, she was really willing to help, but she cannot just allow us there. Someone else from the city has to do that, but she asked for help for her team, so we are going to help them. so that's just good news, and that made me happy, because apparently some of them, they are not so okay. So of course nothing is solid set here yet. So I will be just letting you know how it is going, but it appears that I also I must say that I understand also this bureaucracy, because they are also overwhelmed. They were not prepared for that, and they are really also overworked, and so I understand that this takes time, and it's frustrating for us, of course, because we are ready to help and we want to help, and that's why we have to push it. But thank you, Nipin, for this idea about United Nations for refugees. I think this is a very good idea. I will reach out as well. I'm not here alone. Together we are 5 therapists for the moment, but we also have possibility to recruit more therapists here in Warsaw. So only when we will be allowed to work, we have a nice team here. So that's the outcome of organizing this meeting last week. So thank you, Carla. Thank you very much for that. Thank you.
Magdalena, I can suggest you one thing also. Probably you know, but I don't know.
Yes.
There is new center just opened by Jurek Owsiak. This is one of the most famous and the biggest NGO in Poland.
Yeah.
They are collecting money every year, amazing amount of money. And now they built just nearby the big railway station, Warsaw East.
Yes.
Tent for how many hundred of refugee with beds and so on,
yes.
600 or 700 beds. So maybe with him you can talk, because he is really independent from any other government and community and so on. And he is so powerful that nobody can say him stop.
Yeah, that's true. That's a very good idea. Yes, I'm going to Central Station, and then I will also go there.
It's not Central, it's Warsaw East.
No, I will do both. That's what I mean. The East.
Okay. But Owsiak
Well,
is Warsaw East.
Lovely. Thank you. Thank you for the idea. Thank you.
So I want to just say something about what you said, Magdalena, which is really important. Like going to the train station with your students and just working, doing ear seeds, just there, whatever. This works if you live in the place where refugees are coming. Unfortunately, we can't send people yet to that situation because, so many people want to come to help you. But once it's more secure, then we can do that because there are many people who want to come, and we've been screening them or vetting them. So that's the idea of going to the train station in that situation and working directly is like, that's the front line. And usually nobody knows you're doing it. So it works.
I'm also having such an idea that because, the biggest point, the biggest groups of people are just behind the border.
Mhm.
Premation and so on. And I was thinking that, well, I'm in Warsaw, there's several hundreds kilometers, and I have 2 jobs, so it's really hard for me. But I'm thinking of just organizing some trips there, just
Mhm.
to just how to organize it, and maybe some just team of, I don't know, 5 people going there for one day,
Yes.
with a driver, and just working there one day in the weekend and coming back, something like that.
Yes.
So, but maybe we would need more volunteers for that. Anything can be organized. We just need to, work step by step.
Yeah. And I know I'm going to talk with you directly this week. So,
Yeah. We will talk on Saturday.
Yeah. So Pedro's not here, but I'm directing everybody from Portugal to Pedro Albuquerque, who's our point person there. To your point, is Christina here from Romania? She was here.
Yes, I'm here.
Because Christina is in Bucharest, and they're organizing a group they just did a
I'm here,
NADA
Barbara,
training.
I'm here.
Where are you?
I'm here. I'm talking.
Okay, let me
Put on
put
speaker
on.
view and you will see me.
Yeah, I'll see you. Okay, good. Tell us a little bit about what's happening in Bucharest.
So we've met with Irini today,
Mhm.
and we went to a refugee center and tried to work out things for us to go again tomorrow. We found out that there's bureaucracy as well, but the people there were so very open and relaxed somehow. They said they will ask for approval for us to come and offer services there, but they invited us tomorrow anyway, because we said, listen, if you don't get approval for us to work with the refugees, maybe you want us to work with your volunteers, because you have several here all day during day and night shift. And apparently they said yes to that.
Good.
And they will also try to put a poster up maybe for refugees if they get the approval, so they can come to us as well. It's a bit more complicated than I thought, because they are living in rooms. It's not an open space where we can interact with them and they can actually see us doing that and come and be curious. So we will have to find creative ways of organizing ourselves. But what happened is that we gathered a group of 7 people today interested in this, and we organized in a WhatsApp group together. There's a person in the group who wants to find out about the centers that have refugees stay longer. They asked for asylum, and there are special centers where they will live for a while. Because the center we've been to today, there are people staying in between 2 nights and a week, maybe 3 weeks as an exception. But there are semi-permanent housing somewhere in Bucharest. We need to find out where. We also did a practical training with Irini on each other, and tomorrow we will be going to offer this for the volunteers at the center. And it's really encouraging to see that there are more people gathering for the cause. Yesterday there was no one except me and Irini, and today we suddenly were 6-7 people who said yes, and actually came from yesterday to today. Stuff just happened spontaneously.
Thank you. Thank you. That's awesome. Thank you.
Thank you. Oh,
So now people are getting an idea of how this stuff gets organized, right? Every place is different. And so Irini, just so you know, is the coordinator of our organization in Greece, where we've been working with refugees since 2016. So Irini had gone up to the Romanian border and did exactly what Magdalena said that she wants to do with her students. She offered treatments for 4 days, and then she stopped in Bucharest to work with Christina and the other practitioners there to start practicing and figuring out how to go. The last thing I want to say about that is if you're in a place where you are approaching a refugee center, for example, to work, we have a really good document that can be translated into your language so that the people you're talking to and asking for their place to treat people understand what we do and why it would be helpful. And the idea of treating the volunteers or the staff of the place that is running the organization that you want to work with is really often the first thing. And that works. Once the volunteers or the staff experience the treatment, and now I'm talking about NADA, okay, is an easy one, they get it because then they feel it in their body. And then they can see, oh, this can help the people in my refugee center, the 100 people who can't sleep at night. I get it. So treating the volunteers is really important because they're going to work 24 hours a day, 7 days a week, and they will burn out. They need care. So it's a really good thing that you're going to do tomorrow. Let's see. I want Marianne.
Carla,
Yeah.
there's one question on Romanians' lips.
Yeah.
It's a kind of a bureaucracy question. We're trying to figure out how could we say that we come from Acupuncture Without Borders? I came with the idea that we can say we've been trained by Acupunctures Without Borders.
Yeah.
But
Let's have this conversation not here. I'll work with you guys on this. We have a good answer for that and give you what you need for that.
Yeah.
I have to find a Romanian translator, so that's the only thing. Okay, I want to give other people a chance here. Mariana, do you want to talk from Netherlands? I know she's here.
Yes, I'm here.
Yay.
Yay.
Introduce yourself, Mariana, and then.
Okay. I'm Marianne ter Westerland. I'm an acupuncturist since 1969 in Holland. I'm having my own practice, and I saw the call for practitioners in Poland, and I thought, well, I would like to go, but leaving the practice here, my clinic here, for a few weeks is too much. And then I thought, well, why not organize it in our own country? Because lots of refugees are coming too. So we talked to Carla, I think now 2 weeks ago, 3 weeks, 2. And with Annette Tapia, I think she's here too. We started organizing it in our country. Today, the first clinic opened in Den Haag. That's nice, yes. And we also have found accommodation in Amsterdam. There's the Shenzhou University who offers us 2 classrooms. We also have a site found in Eindhoven, that's in the south of Holland. So yeah, we're working on it a lot. We have a lot of volunteers, I think about 70 now. It's a bit more difficult to get them organized, to find someone who wants to be team leader. I think it's about having the responsibility, but we'll work that out. So far for Holland.
I'm really excited to hear that you had the first clinic today. That's awesome.
Yeah.
So that's what happened in 2 weeks.
Yes.
So, and you guys are amazing. So one of the things that happens in this work is that when a team organizes itself well and successfully, then we ask that team to help others do that. So you're at the top of the list, Mariana.
Not yet.
Not yet, but down the road. Yeah. Okay.
Thank you.
See. Is Annette here? Did she want to talk at all?
I don't know if she is.
Okay. Let's say I wanted to know if Susan's here, Susan Andrzejczyk from Prague. She may, I know she was here for the last training, but she may not be here now. Okay, that just tells, just so you know, there's definitely a Prague group that's forming slowly but surely. And then I just wanted to recognize some of the UK people. Nancy Ellis is somebody I haven't met yet. I know she's here. And we have a Zoom call tomorrow with her, and I'm inviting the other people that have expressed interest from the UK. So that's going to happen pretty quickly. I have had a number of people from France write us. I'm looking for a team leader in France, if anybody knows anybody who's interested in that job. And in some of the other countries where maybe there isn't anything organized yet, again, if you will write to me directly and tell me that you would like to organize something with other people in your country, then we can make that connection happen. So I think that we're doing pretty well for such a, at this point in time, notwithstanding, you know, hopefully 2 months from now, we're going to have a lot of projects all over. I want to summarize by saying that our role as AWB here is to help you do it where you are. So that means training, that means supplies and other kinds of financial support that you might need in certain ways. We have limits on that, but we have some. And when I say training, I'm going to say more one-to-one, where one of our experienced people on the staff would work with your group. So that, for example, I'm going to work with the Romanian group that Christina just described directly, or I work with Mariana and Annette on the Netherlands group. And so we have those kind of resources to help you work in your community and in your country. So I'm going to really encourage you to think about how you might want to plug in, how you might want to be involved. Send me ideas if you have other training that you think you need in a big setting like this. And some of what some of the training, we have many trainings on our website that are more in depth, where you can learn more about trauma and how you actually set up projects. So I would encourage you to go to our website and look at those. The last thing I want to say, and then maybe Nippon, if you want to finish with anything, is that we are going to come to Europe in the first weekend in June. Okay, we're doing a 3-day training in Berlin, which was set up before COVID. Okay, we rescheduled it to June before there was a war. Okay, now that training is taking on a whole other meaning, because it's an opportunity for us to come and work with people directly in a more in-depth way, both to gain trauma treatment skills, but also to learn how to organize things. Because again, this is the hard part. And how to work together on teams, for example, how you work on a team to set up a project, and how you avoid problems in teams. All of these things are very relevant to this work. Also, how you avoid burning out, how you avoid developing secondary trauma when you're working, seeing so much suffering. Okay, this is a really important part of the work. So if any of you want to come to Berlin, you're invited. And we will be doing that training online as well. It's a 3-day training though, it's a commitment. But myself and 2 other American trainers are coming, who have a lot of experience in training people in the countries we work in. And we will also be inviting Irini from Greece. She will be there, the person that just was in Romania. And she will also talk to you about the work in Greece and how you can even volunteer in the clinic there with refugees from other countries. And we'll probably have some of our Israeli, we have many people we've trained in Israel who will also come. So it will be an opportunity to connect into the larger AWB community if you're interested, and get some real training if you want to do this work. That's also on our website. And I think, Carrie, did you put it in the chat box? Yes, no?
I'm sorry, I was typing something, so I missed that.
Okay.
The
There's too
aroma,
many questions.
yeah, the
Okay.
aromatherapy or is that what you're?
I was just gonna say also the Berlin training.
Oh, yeah,
For
I can
people
put
to
that
see
link in here too. Yeah.
Okay. So if there are any other questions, please ask them now. Are there any that came in, Carrie, before we sign off? Because I know people probably want to go to bed.
Yeah, mostly people just asking about specific countries like Sweden and Germany, wanting to do work there. I just
Okay,
said to email you.
Yes, and let me just say something about Germany. Germany's a special case because Germany has a very developed acupuncture community. And I've been actually the first people we ever met with on this crisis were the German acupuncturists, primarily the NADA practitioners. They have a very strong NADA organization. They're going to be doing the big TCM Congress in May that I don't know if people on this Zoom call attend. I know it's going to be online, and I am going to be speaking on that to talk about this work. So Germany, if you want to do things in Germany, I know I've gotten a few emails from someone in Munich, and I can't remember where else. Please write to me because there's something for you to already plug into. Sweden, I used to live in Sweden. I like Sweden very much. It would be a place where it would be really good for us to have some people start organizing because you already have a very large Swedish refugee community, and you're going to get a lot more. It looks like that from what my research is. So if you are in Sweden and you're interested, please contact me. I know somebody else from Finland are also connected to me. I am meaning to write you back. So again, and Ireland as well. So I haven't, please know that I'm going to write back, but Germany and Sweden definitely, and probably Ireland would be good if you could, if we could set up a phone call as soon as possible. Anything else?
Well, someone way back had asked about the brand of the Greek oils that you
Oh.
used.
You know what? No, it's in Greek. So, so I need to take a picture and send it out. Maybe, you know, if you, yeah, I don't know. Whoever wrote that question, send it to me by email and I'll send you a picture of, and so you can see the brand because it's in Greek. Anyway, yes.
I just want to get in before everybody sign off, just to say
Yes.
one more reminder. As I picked up in the front, I know some people join later. The work is as much a challenge we face, is as much about people knowing about what we can do in contexts like this. So one of our mission is to amplify that work. So in your work, what you're doing, please do document, send us pictures or what to let us know where your work is going on a daily basis. We are able to get that out there to our communities and amplify that more. This all helps as an ecosystem for convincing others who are not convinced on the front line. So if you're able to show an amplified story of something happening in Poland or Romania, we are able to then take others notice of that and make that as a case to bring them forward. And also you are in a very active situation where there will be media and news people around. Again, you are probably connected, your networks, you're not thinking about it. And it's not about, again, showcasing your work, but it's about showing what as a community we can bring to this. So look for such kind of connections, especially when you're working in centers and other areas, you will run into them.
Yeah.
This is the time. So please keep an eye out and please do engage. Don't worry to engage. If you need any support in providing them what we are explaining, that again, we can back end support to give any materials about wider work and things like that. We can help you with that too. But don't miss that opportunity. This all is able to create opportunities for you to work, and also in the long run make it smoother. Have the support you need on the getting more people out there and the support and resources you need to get. So just a reminder on that. And amazing for everybody staying on for this long and taking the training. And thank you so much. It's been a great meeting you all. I'll pass it over to Carla to close.
Yeah, I just want to amplify what Nipin said. I'll give you an example. Irini in Romania this week, a London reporter came and took a ton of pictures to do an article in London on what was going on at the border, including her work. And so she couldn't capture that because she was busy working with people. This is part of why it's good to have a team. Okay. You have somebody on your team who can think about photographs that are appropriate. Okay. Appropriate photographs that protect people's privacy, but still show what we're doing. And this is essential. We could not raise money. We could not do this training today if we didn't have that kind of visual presentation to the world. It's also part of how we educate bureaucracy in Poland or the Red Cross or the UN about the power of what we can offer. If people can't see it, it won't happen. And so it's not about taking advantage of people in a bad situation. It's really about using that moment, as Nippon says, to further the support and understanding in the community at large about what we're trying to do. So it's it's as important as the treatment, actually. I know it's hard to think that when you're in the middle of doing the treatment. So thank you. Anybody else? I'm going to say good night unless there's a burning question. Carrie, any other burning questions?
I don't see anything else.
Okay.
No.
Thank you, everybody, for coming. And this will not be the last time you see us.
Yeah.
All right. Good night.
Thank
in
you,
every
everyone.
language. Good night in every
Bye-bye.
language. Thank you. Nippon, can we stay on a minute?
Yeah.
Is everybody else gone?
Yeah, counting down. We're 40 now.
Okay, let's just stay on for a minute. I'm learning how to use Zoom better in all of this.
Aren't we all?
Well, no, seriously, it's become much better, much better. Or you know what? Let me talk to you. I'll just call you on FaceTime. Okay.
All right.
I'll close the meeting. Bye.